Capitol Report is a production of Senate Media Services.
A new Senate committee begins work on health care access and affordability. We'll talk with the committee's chairman. And what if you want to testify before a legislative committee? We'll show you how. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. This week, the Senate convened a select committee that will make recommendations to the legislature to improve consumer access to and affordability of health care in Minnesota. Here are some highlights from their initial meeting.
Based on current trajectory, we expect healthcare spending to continue to grow, to consume a greater portion of the economy. In 2014, about 13.6% of the economy is devoted to healthcare. That would grow to about 15.8% in 2024. By itself, that may not be a drama or a disaster, but it will require us collectively to reorganize our priorities. And here's an example of pharmaceutical spending where you have in 1 month about a, 2,000% increase in drug spending. This happens to be a low-cost drug in 2009, and it still is a low-cost drug, but nevertheless, and doxycycline is a antibiotic. I hope I have this right, doctors, but an antibiotic that is most frequently used for treating Lyme's disease. So a lot of people will be getting that drug, and the impact of even large changes on on low-cost prescription drugs is measurable.
Mr. Chair, you know, you and I have been treating patients for, in your case, several years, in my case, more than 20 years. And doxycycline is something that was an old drug when we were young men, and it was cheap when we were coming out of residency. So for it to suddenly exponentially increase in price, I think your gentle phrase, whiff of antitrust, is well taken. And this is the problem. We've made a fair arrangement, Mr. Chair, if you'll allow me to just expound. With pharmaceutical manufacturers, where we balance the benefits of society's need for life-saving medications with the need for an intellectual property organization to develop product and reward shareholders. And that arrangement, that 17-year monopoly arrangement, has worked out for a long time. I think it's the right balance for our country and our state. The difficulty arises, and especially recently, it seems, when pharmaceutical manufacturers attempt to subvert that arrangement.
For the consumer now, they have the power of the purse. One of the things that you have to believe in, if you think that Gravie is a good idea, is that when individuals are left to their own devices and they make their own choices, they're happier with them and they stick longer with those choices than when somebody else makes those choices for them, especially in something that is as emotional and as important as someone's healthcare. I don't think Americans like somebody else to tell them what to do, which doctor to go to, which doctor not to go to, and certainly not their employer. But because the consumer is so removed from making those decisions, I bet a consumer doesn't think that they're getting $10,000 worth of value out of the health insurance that their employer is paying for them. So the first thing that I would do is there are so many rules and regulations and laws that are geared towards preserving the existing incumbent employer-centric system. I would systematically go about dismantling those in favor of empowering the consumer.
As lawmakers in our nation's capital continue to debate health care, Minnesota's newly formed Select Committee on Healthcare Consumer Access and Affordability has begun meeting. Joining me in the studio is the chair of this new Select Committee, Senator Scott Jensen. Welcome.
Thank you, Shannon. Appreciate it.
The healthcare conversation lately has become largely about premium, prices, and insurance coverage, and less about actually caring for health. In fact, many people spend more time talking to insurance companies than to their doctors. So how do we fix this? How do we change this?
We have to change the narrative. We have to focus on cost. When a person goes to a grocery store, they've got a certain number of items and each item has a price. You add all those up, that's the cost. That's the cost of healthcare in the state of Minnesota, the cost of healthcare in the United States. So 5% of the gross domestic product in the early 1970s was devoted to healthcare. Now we're closing in on 20%. Why is that? It's because of cost. We do more things, and those things have higher ticket items, higher prices, if you will. That's where the focus has to be. We need to talk about cost.
Now, some people say that some procedures cost more in one place than another place, and depends on your insurance and which insurance and how it's paid for. Should there be a standard price for everything?
A loaf of bread at Byerly's might cost more than a loaf of bread at a Cub food store. So I can understand some differences in price, especially in terms of hospitals that have greater needs in terms of providing services across the board. But in the world of primary care, I don't see a reason why we can't have a uniform set of costs. It's difficult to break into the world of healthcare. So in the same way that we have public utility agencies to help determine costs, I think it would be reasonable to do the same thing in terms of physician costs. If we did that, then we could get to true transparency so the consumer would know what they're going to pay. If you asked me at my clinic to post our top 10 items that we do for patients, we have 10, 15 different fee schedules. Which one should I post?
That's complicated. During the last session, the legislature initiated a state reinsurance program to help insurance companies who are covering really high cost individuals. Was this a Band-Aid, or is this part of the solution going forward in terms of how we're paying for health care?
I think it's both. I think it's a Band-Aid in the sense that if you're bleeding, the first thing you got to do is stop the bleeding, so put a Band-Aid on it. And that's what we needed to do. So I think the whole issue of premium rebates and reinsurance was part of that. But it's also a solution going forward, because if you look back to when Minnesota was a leader in healthcare, we had one of the lower numbers or percentages of uninsured. We had MCHA to take care of that high-risk pool of people. If you go back to then, we had something like that. We had a reinsurance mechanism. That's what we put in place again. That sets the stage for us to do the next thing, which is to focus on cost.
Well, and so you bring up how Minnesota used to be a leader in healthcare. We used to be on the front edge of how we treated people and how we paid for healthcare. That has changed. Can Minnesota take that leadership role again? Do we have the expertise? And should states be more in control of healthcare as opposed to the federal government? Where do you come in on that?
The first question, can we lead once again? If we don't, we will have failed. We have people like Michelle Benson, Tony Loehrke, Jim Abler, Paul Gazelka. We've got 2 physicians in the Senate. We've got Matt Dean in the House. We've got people passionate about improving health care. We can lead again, and that has to be our goal. I think we can.
Should it be left up more to the states instead of federal? I mean, how much of a role should Minnesota policymakers be taking in determining how healthcare is delivered in the state of Minnesota?
If you look back, when Minnesota was a leader, other states looked at what we were doing to see what they might do. You have to allow that to happen. The federal program can't be as tailored and coordinated to our needs. So I think absolutely the states should be allowed to lead. They should be allowed to slice and dice. What do our folks need? What's going to work best in our part of the world? So I think absolutely.
What do you hope for in terms of outcomes with the select committee?
I hope that we provide the basic ingredients for a robust piece of legislation that will be presented to the legislature next March in 2018. It'll first go hopefully to the Health and Human Services Committee to be reviewed and analyzed and discussed further. But I want to talk about things like transparency, consumer tools. I want to talk about drug costs. I want to talk about essential health benefits. These are the things that we need to really dig down deep into the weeds. And that's what Senator Gazelka asked us to do.
You mentioned earlier lowering everyone's health care costs. Is it still true today that the more people that are covered by insurance, the lower the health care cost? What is the role of insurance?
I don't think that that really is true. I think when someone says, gee, if we insure everybody, will the cost of our health care go down? No, I think basically it'll go up because more use will take place. If you look at 1965, when we put Medicare and medical assistance into place, no question, appetite for services went up. There's been an inflation of both number of procedures and along with that, cost. So I don't think we should delude ourselves. Costs will go up. What we need to do is, as a nation, as a state, as a legislature, we need to decide what can we afford. And then we need to talk to all Minnesotans, all United States citizens, say, you need to be a part of the solution. This is not a we-they proposition. This is not a Republican-Democrat issue. This is about our country.
Does a cap become part of the conversation in terms of how much the state or the federal government will pay in terms of covering people's health care costs?
When we get back to how to pay for it, then I think we divert from the role of this committee. This committee really needs to stay focused on costs. How do we reduce imaging costs, drug costs, things like that. But in terms of what the feds are talking about in terms of capping, that's a work in progress, and they're talking about this option, that option, and the other. I'd prefer to sort of stay focused on what we need to do right now.
One last question for you. How does the rising cost of prescription drugs fit into this whole picture?
If you actually look at the pie of healthcare costs right now, one of the most rapidly expanding chunks of that pie is pharmaceutical costs. There's stories all over the place about how ridiculous things are in terms of cost. I had one patient who was paying $70 per pill in this country, but then when he chose to reach out to a Canadian online pharmacy, that cost went from 70 down to 7. We've got stories about doxycycline tablets going from $0.25 a tablet to almost $50 a tablet in some situations. Somehow we're going to have to address this issue.
Senator Jensen, I want to thank you so much for your time today and good luck with your select committee.
Thank you very much. I appreciate it.
Many people think testifying before a committee is a daunting proposition. Producer Jon Brune explains what committee members expect to hear from constituents.
The committee process is a primary step in developing and passing legislation at the state capitol. Those who testify during a committee meeting can play a significant role in determining the outcome of that legislation. Often those who testify are government officials or lobbyists, but the voice of the public is also a key element in the committee process.
I think public testimony is really important for a number of reasons. Legislators simply cannot be experts on all topics. You usually have 3,000 bills that get introduced in a legislative session on a lot of different topics, and they may serve on 4 or 5 committees, so it's really hard for them to become experts in every single topic. So I do think that public testimony provides an opportunity for them to hear a perspective that they may not have thought of.
The personal experiences of individual citizens brings important and valuable testimony to the process, providing lawmakers with another point of view to consider when debating legislation.
We know every bill has an impact on people's lives. What we want to hear is how does that person testifying and addressing the Senate feel about that bill? How would it affect their lives? What is the story behind it? Stories are really powerful in moving legislators and helping to form an opinion. And it's a great way for us to see a real-world application of some of the things of the issues we're addressing.
It is those human stories more than anything that absolutely touches legislators. When somebody comes in and really connects with us and tells us how something has affected their lives and their families and their communities, it absolutely makes a difference.
Personal experience is one way to have an impact at the Capitol. Being well organized and keeping statements brief are others. On any given day, legislators sit through numerous committees, wade through pages of data, and listen to hours of testimony. Using time wisely is key to committee testimony.
There are 2 items in the direct care and treatment services area that I would like to specifically mention. The first is the child and adolescent.
I have kind of 3 little quick rules that I try to follow. Keep it simple, keep it short, keep it focused. Legislators, you have to respect their time. There's usually a dozen or 2 dozen people waiting in line to testify on given bills. So your testimony really needs to be at a pretty fast clip pace. I try to keep testimony usually at 2 to 3 minutes. I try to get to the important things right up front. I usually try to focus on just 2 to 3 points, because if it gets much more than that, then you're diluting what message you're trying to convey.
Keep a presentation around 2 to 3 minutes if you can. That leaves a little time for senators to ask questions if there are questions. Make sure that you're prepared. You know what you're going to talk about. Don't just come up and wing it. so to speak.
Credibility is the currency in which legislators and professional and citizen lobbyists deal. Truthful information is any testifier's best friend. It is the foundation for the laws that are passed at the Capitol.
Being forthright, credible, and respectful are the cornerstones of great testimony. We base our decisions on the information that is being presented in these hearings. So to be credible is extremely important.
The whole testimony process, really, you're not sworn in, it's not a court of law, but it is based on a trust system that you are telling the truth when you testify. It's important for a lobbyist never to bluff, never to provide false information. They don't want to exaggerate or extend the circumstances that may have happened to them. Just be specific, and if there is a question that they can't answer, they can offer to get back to a legislator as well.
Participation in the legislative process takes many forms. Meeting and corresponding with lawmakers are common methods. Committee testimony is another, one where lawmakers welcome and encourage public participation.
I think we all have that image from congressional testimony where someone stands up and holds up their right hand and there are all the photographers sitting in front of them. It is nothing like that in the Minnesota legislature. You'll have a couple of people sitting at the testifiers table, and you'll have a line of senators or representatives there to just sort of listen, and then there'll be maybe a little dialogue after the fact. But the whole point is to welcome people into this process.
I'm a mother of 3, I'm a housewife.
Legislators are very respectful for people who are testifying for the first time. Think of it as just communicating with 10 people, try to block out all the other people in the room. You truly are the expert at your story. Nobody else knows the details or what perspective you bring. You're sharing your thoughts. These aren't things like a test where there's a right or wrong. This is your perspective.
We appreciate you making the effort to be here with us. Thank you for your time.
I did not think I would be here sitting telling you that, hey, I got you.
Giving testimony does not guarantee passage or failure of legislation, but it could influence one or more committee members, and that may be enough to determine the outcome.
I think, and this is something that any of us who are trying to be persuasive in any facet of our life, what we're trying to do is get a message across and persuade somebody to see it our way. And I think the most important part of that is to be really clear on what you think is the most persuasive point you can make and how you can make it. And keep it simple.
Try to identify what the problem is and what it is you would like legislators to do about it. It's not just good enough to get up there and say, this is a problem, this is a problem, this is a problem. How do you want legislators to help solve that problem?
If you're prepared, if you hit a few key points, and if you can make it personal, you've got an effective presentation. A legislator may not walk in your shoes. We don't have your experiences. We don't have your perspective. And that's what we're looking for from you. We want you to share with us how laws, bills affect your life.
On the one-year anniversary of the death of St. Paul resident Philando Castile during a traffic stop, Governor Mark Dayton called a press conference to recommend that the new Law Enforcement Training Fund be named in Castile's memory.
Today is a year from the tragedy which occurred, which took the life of Philando Castile. It's one of the very most traumatic events that's occurred in my 6.5 years as governor of Minnesota, and it's had long-lasting traumatic effects on so many people. People who, from their own personal experience, life experience of family and friends, have experienced those kinds of tragedies and fears. And it's also had a terribly difficult, created a terribly difficult situation for many of our tremendous law enforcement men and women who risk their lives every day and night to keep the rest of us safe. So everybody has been, I believe, brought to face with some of the pervasive challenges that we face here in Minnesota, which are difficult for for people like me, especially older people who grew up in a pretty much homogeneous Minnesota environment and now are living in one of the many diverse states in the country. And an incident like this shows all of us that we have a lot more work ahead of us, a lot more we need to do working together to improve the quality of our relationships with one another and with the institutions of our society, with the communities in our society that reflect this increased diversity.
We need this extra training for our police officers because at the end of the day, everyone wants to go home. The police wants to go home and the civilian wants to go home. And if we can combine our minds and work together as human beings, then that will happen. We have to learn how to communicate better with one another. We're supposed to be the most intelligent species on the planet, but look what we do to one another. We're worse off than some animals, you know, that just go around and prey on people and kill each other. And I think this bill would be very, very helpful in our relationship with one another, with the police.
The community needs to learn how to de-escalate and learn conflict resolution skills as well. They may not have the funding, but we need to have people who are willing to go into schools and go into rec centers and teach our young people how to handle situations when they get into them. And that's one of the things that I plan on doing.
Libraries are valuable assets in every community. At the state capitol, lawmakers and citizens alike benefit from the resources of the Legislative Reference Library. Producer Jon Brune outlines the services of this unique legislative office.
The Legislative Reference Library is a valuable resource for state legislators and staff, as well as for members of the public, including lobbyists and state agencies. The library's collection of state documents and periodicals and wealth of historical data and statistics provides important information that aids those involved in decision-making, thereby helping to shape the outcome of public policy in Minnesota.
The library's collection is primarily public policy, so it's probably the best public policy collection in the state. And we collect materials from all over the country, materials from interest groups and research bodies. Magazines and newspapers are really important to the work of staff and legislators around here. We subscribe to 400 periodicals and we subscribe to, I don't know how many newspapers, maybe 35, 40. And those are really, really important. We get them in paper, but probably more importantly, the newspapers we make available on the desktops of legislators and staff. So any newspaper that's from Minnesota that we can provide to staff and legislators, we provide that. We also are the state document depository library, so we collect all the reports that are produced by the state agencies, and we're the central location for those materials, but it also supports the interest and research needs of the legislators and legislative staff too. I think a lot of legislators don't have the ability to track every single issue. They're often sending us an email request like, what is going on in Duluth regarding this issue? Or one question that we get a lot is, what are the editorial writers around the state saying about a particular issue?
The library features a strong historical collection of documents and statistics. Ongoing updates in the current digital age makes it easier to provide more information for future research.
We have state documents back to the early 1970s and then going back to the beginning of statehood actually, but a broader, a richer collection starting in the early 70s. A lot of those materials have been digitized since 2003, so almost every state document that's been published has been archived and made available through the web. So there's a lot of materials that are accessible to anybody in the state through that, through our catalog. We are charged by House and Senate rule to collect committee minutes for the House and the Senate. Those materials are the primary records of the committee's actions. in the House and Senate. So those materials include testimony from individuals and bill amendments and reports and documents that were discussed in the committee. So those materials are really helpful as people do legislative research on the history of legislation.
Since 2004, video of legislative hearings and floor sessions have been archived on the internet and can be accessed by any computer. Prior to that, audio recordings of legislative activities were archived on cassette tapes. Those can be accessed at the library. In addition to its collection, the library also provides a more personalized service, delivering information to legislators on specific topics of their choice.
I think the best thing that we do are our current awareness services, which is sort of library lingo for customized information that comes directly to you. So any legislator or staff can submit requests or let us know what topics they're interested in. And each week we send out a customized list of citations to articles in their interest area. It's fully automated, so they just click a little box and they get those articles within 24 or 36 hours delivered to them electronically. They can also get them in paper. There are a few people that prefer paper. Each day when the periodicals arrive in the library, the librarians go through the periodicals and enter into a database the articles in a particular topic area. We each have kind of an area of specialty. They're entered into the database. The database spits out a customized list at the end of the week for every person. It goes to them electronically and they can select them. We have another system that allows our library aides to scan those or copy them and send them electronically. So we have really sophisticated programming, helps this service run really smoothly. And we, I think last year we provided well over 10,000 articles through that service alone. As you might imagine, those services are really popular. We have a lot of contact with legislators and staff through those services.
The library's added space on the third floor of the new Senate building has resulted in more participation with senators and staff. Though it is considerably smaller, the Senate location provides the same services and accessibility as the original library.
We have this great spot here and we have this great spot in the Senate building, but we are really able to provide information without anyone ever coming to either of those locations. We can save them a lot of time.
From extensive research to simple questions, the Legislative Reference Library plays an important role in the legislative process.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.